Hello, my name's Nancy. This is my practicum project for our last and final class. Congratulations to everybody for making it so far. What I wanted to do was something about the care of the immediate post-op open heart patient because that's typically what I do at work. I'm an open heart nurse, have been for many years, actually working in critical care for way more than 30 years. I hate to admit actually how long that I've been doing it. And I've actually probably been orienting for 20 of these years. One of the things that I've noticed over the years when I orient people is that when you have an emergency situation and somebody comes out from OR extremely unstable and needs to go back immediately, a lot of times, what happens is that we quickly take care of the problem and then we send the patient off and then we do some teaching, but it's hard to really tell somebody exactly what you're doing, why, when time of the essence. So that's kind of where my idea for this project went. So I had been talking to one of our staff members is actually a PhD at the local college, and we had actually been talking about the idea of possibly sending our new nurses to the unit to critical care to like a critical care program. And then we were thinking that maybe we could actually add a module that had something to do with the care of the immediate post-op heart patients because it's nice that really nurses are enthusiastic about critical care. I love when you have new nurses because I think they bring new blood into the unit and they're excited to learn and their attitudes are really positive, which is a great thing for a unit. But on the other hand, it's also very stressful for them. So we had decided that if we did a presentation and assigned readings, and then we did a simulation, they would be able to actually have some patient experiences with the simulation, and it wouldn't be as stressful as taking care of a live patient. So the objectives were to the nurses would be able to describe the different types of heart surgeries, explain the rationale of the nursing interventions, what we're doing, examine the typical post-op orders for the patient, and have the ability to identify potential complications on their physical assessment and actually decide what that they should do in order to help the patient achieve the best outcome. Also, of course, medication review, why we use them, what we use, how you titrate them, and what exactly they do. Because in taking care of the open heart patient, a lot of times you'll use two drugs that you really wouldn't think that you would use together. Like sometimes we'll put somebody on a little low dose of levo in addition to just a little bit of cardine, depending, and it sounds counterintuitive, but sometimes it actually works and it's kind of what that patient needs, so it's a skill of learning how to juggle all those medications. Also, developing course nursing care plans, including the patient and the family and education, because a lot of times the patients are very scared, their families are very worried how their life's going to change, what their post-op recovery is. All those are really, really important factors to consider. Um, Incorporating simulation in this program was the really big thing for me. I was so excited to go to the simulation lab and actually be able to experience and kind of work with them a little bit. And it was an eye opener. Like when I started, we practiced on real people. We didn't have simulation, and I thought it was great. And the things with the high fidelity simulation that you can do are just so wonderful for have people learning in a some non-stressful atmosphere. Now, of course, you could also use simulation as testing, so I'm sure that that stress level would be up when you do that. But as far as like learning and being able to apply learned concepts there and discuss stuff and debrief, it kind of reinforces your learning as you're doing it, so then hopefully it will actually help it sink in a little bit better. In one of the literature reviews that I did, they had one of the learning theories that they applied to simulation was the Kolb's experimental learning theory. And what that had to do was there's four different areas. One is the concrete experience, which is the experience that you have while you're doing the simulation. And number two is the reflective observation, which is what the learner does after they're getting the debriefing, and then the abstract conceptualization, when the instructor helps the learner kind of remember all these things and incorporate as a part of your thinking process. And then the active experimentation, where you actually begin to apply your learned knowledge in practical situations. The downsides of simulation: it can be very expensive, especially high fidelity situation. There's a lot of different simulations, but high fidelity seems to be the best, but it can run into thousands of dollars. So what I did for my project was designed a critical care module, did some assigned readings, did a PowerPoint presentation and a lecture, and then designed, excuse me, I'm sorry, I have a cold, 2 different simulation exercises. One dealing with bradycardia, which is a very common post-op situation, and another doing with hypovolemia, which is another common post-op problem that people have. And what we were going to do is we're going to have 2 different simulation class times, which due to unforeseen circumstances were canceled. So unfortunately, I was unable to test those scenarios out on any of our new nurses, because they were going to come and play with me, so to speak, to give me some input on our project. I was able to deliver my PowerPoint and my lecture to both experienced staff and new staff at different intervals, and it was mainly positive. There was a few things that I made. In addition, I submitted both stuff to my mentor, Dr. Copeland, and she gave some valuable input too. Um, in addition to being evaluated during their simulation exercise, there was also an exam that people had, that the staff had to successfully complete also. The impact on nursing is, if you can adequately orient your staff and they feel comfortable in their knowledge base and in their practice of nursing, I think generally they're going to stay around longer. So I think it's really going to help with nurse recruitment. Of course, the biggest, highest priority is that they're going to be able to deliver safe, competent patient care. And the fact that they can do that is going to increase and positively affect patient outcomes. Number 2, and 2, you're building somebody's self-confidence while you're supporting them through their education. I mean, it's a challenging thing to be oriented to critical care, and your success should be celebrated. So I think that it helps the staff, it helps the patient, and it helps everybody as long as you can orient your nurses successfully. And I think simulation is a great tool to utilize in doing this. I'm interested to hear about everybody's projects, and I hope everybody did great. Congratulations. Bye.